Welcome to Developing Clinical Questions. Understanding the five-step evidence-based practice process is an essential step for creating EBP continuing education programs and the potential for the greatest patient outcomes possible. This presentation will focus on asking a searchable clinical question. Developing a sound clinical question is the first step and for some the hardest step of the EBP process. Clinical questions should be narrowly tailored and focused on the patient. Broad and general background questions are not appropriate for EBP continuing education programs. Questions that focus on the clinician are not compliant for EBP programs either. The most important aspect of finding the right answer is starting with the right question. Question writing is a skill that takes time and practice. As you work towards formulating a clinical question, consider what the end product you want to achieve is. What is it that you want to know? This should match your needs analysis or knowledge competency or performance gap for your education program. Providers often find it easier to create an EBP program from the ground up rather than trying to develop a clinical question that fits a predetermined answer or program that's already developed. Often developing programs backwards is difficult and feels awkward to even the most advanced clinicians, researchers, and education providers. Developing a sound clinical question is the most important catalyst, yet often the most overlooked step of the EBP process. A well-built clinical question should direct an answer that is focused on patient-centered outcomes and will not only improve the quality of care, but will also increase patient satisfaction with the care they receive. Conversely, a poorly written clinical question can result in one of two situations. Either the clinical question is not clear enough, which produces irrelevant literature during the search process, or the clinical question is so broad that the result is an excessive amount of information obtained from the search that may be unmanageable in the given period of time. These may be background questions. Typically, a well-constructed clinical question identifies specific components. These elements are often referred to as PICO, which identifies first the population, patient, or problem, second the intervention or area of interest, which may include a specific diagnostic test, treatment, therapy, or medication, third the comparison intervention or group, and finally the outcomes. You may also hear these elements referred to as PIO or PICO with a T. In some cases, a comparison intervention or group may not be applicable, so the C becomes irrelevant. In other instances, a well-built clinical question may include a fifth element of time, such as 2 weeks, the acute phase of care, 6 months, etc. Clinical questions may also be grouped into several categories such as diagnosis, therapy, prognosis, harm, or prevention, which allows the clinician or program developer to further individualize their search for the best available evidence. Let's take a minute to look at a clinical question example. Here we've used a table format to identify specific criteria for each PICO component. Our patient population is adolescents with anterior knee pain. Our intervention we're interested in is taping, while the comparison intervention is bracing. We've identified two outcomes, reduction in pain and an increase in function. In this example, we've included a time component within 2 weeks. To put this criteria together, we've developed a well-built clinical question that reads, in adolescents with anterior knee pain, is taping or bracing more effective at reducing pain and increasing function within a 2-week period? When we examine the clinical question, how does it score? Is it narrowly tailored and focused or broad and general? Is it focused on the patient and the outcomes of the patient or the clinician? Is it constructed appropriately? Do the components in the chart match the clinical question? This example is narrow, patient-focused with proper construction. Let's look at more clinical question examples and compare general versus focused clinical questions. The general question on the left inquires about the best method to treat athletes with heat exhaustion or heat stroke. Again, it is broad and general, which would yield many hits in the literature search. This would be very cumbersome to review all of the literature to find the best treatment. On the right, we have a focused clinical question. The patient population is an individual with exertional heat illness. The intervention we're interested in is using cold towels, ice packs, and fans versus the whole body immersion in cold water as the comparison. The outcome is to lower core temperature. There is no time component. This well-built clinical question reads, are cold towels, ice packs, and fans as effective as whole body immersion in lowering core temperature in an individual with exertional heat illness? When we examine the clinical question, how does it score? Is it narrowly tailored and focused or broad and general? Is it focused on the patient and the outcomes of the patient? Is it constructed appropriately? Do the components in the chart match the clinical question? This example is narrowly tailored, patient-focused, and with proper construction. In this example, the general question on the left inquires about the best test for diagnosing SLAP lesions. Again, it is broad and general, which would yield many hits in the literature search. This would be very cumbersome to review all of the literature to find the best test, and we won't have a focus for the patient. This doesn't indicate if the search would include pediatric to elderly, elite athlete, or an inactive person. On the right, we have a focus clinical question. The patient population is non-throwing overhead athletes. This could include tennis, volleyball, swimming, etc. The intervention we're interested in is the O'Brien special test versus the clunk or grind orthopedic special test as the comparison. The outcome is to more accurately assess SLAP lesions, and there is no time component. This well-built clinical question reads, is the O'Brien test more accurate than the clunk or grind test in assessing SLAP lesions in the non-throwing overhead athlete? When we examine the clinical question, how does it score? Is it narrowly tailored or focused, or broad and general? Is it focused on the patient and the outcomes of the patient? Is it constructed appropriately? Do the components in the chart match the clinical question? This example is narrowly tailored, patient-focused, and developed with proper construction. In this example, the general question is extremely vague. On the right, we have multiple focused clinical questions which are appropriate. The patient population is soccer players. The intervention we're interested in examines multiple types of stretching techniques. The last question compares two techniques against each other, with the outcome goal to be improving vertical jump. Multiple focus clinical questions are appropriate when building education programs. As this example indicates, you may not always have a comparison treatment C, thus PICO. Now that we have reviewed development of a sound clinical question, let's review a few common mistakes. First, broad and general background questions often yield large literature results that are sometimes time-intensive to review. Background questions may not be formulated using the PICO or PICO components. If you are unable to formulate a clinical question that is focused, or the presentation is background information, the program probably does not qualify for the EBP category, but rather Category A, Continuing Education. Another common mistake is developing questions that are clinician-focused rather than patient-focused. The principles of EBP focus on the patient and how to improve patient outcomes. Questions that focus on the clinician or how to improve clinician knowledge or skills do not qualify for EBP category, but rather Category A, Continuing Education. In this example, the clinical question, what parameters can be measured to determine efficacy of returning an athlete with a shoulder injury back into normal weight room workouts, has a number of problems. As you review the PICO components provided, the question and components do not reflect and match each other as they should. Use the PICO or PICO structure to develop a sound clinical question. The components should match the clinical question. The last common mistake is when a clinical question is not written in the form of a question. In this example, you can see that the question is more of a statement and not a research question. A few quick tips on formulating a sound clinical question. Begin with asking, what is the end product you want to achieve, and what is it that you want to know? Make sure your clinical question has PICO or PICO components. You may not always have a comparison treatment, see, thus PIO. Be certain your clinical question is patient-centered and focused on an outcome that benefits the patient. Clinical questions are written in the form of a question. Remember to use BOC resources. Formulating a sound clinical question is the first step in developing EBP continuing education programs. A solid foundation to your program will be necessary during development so it does not crumble. This concludes developing clinical questions. Thank you to Dr. Kaylee Bacon and Dr. Catherine Newsham for providing some of the content for this presentation. To answer more of your questions, check out our other videos.